So we can start 66th page. Okay. वमन के 15 दिन पश्चात विरेचन एवं विरेचन के 7 दिन पश्चात अनुवासन का विधान है. So first of all, if you are doing vamana karma, so we have to leave a gap of 15 days. Okay. After 15 days we have to do virejana. So the gap between vamana and virejana should be 15. Okay, 15 days. If you wanted to do vamana and virejana, so first we have to do vamana karma, then after that we have to keep a gap of 15 days, then after that we have to follow virejana karma. Then after the virejana karma, if you wanted to do anuvasana basti, then after doing virejana we have to leave a gap of 7 days and then we have to do anuvasana basti. Okay, so this is the time period we have to keep it. So after vamana, if you wanted to do virejana, 15 days gap we have to make it. After virejana, if you wanted to do anuvasana basti, 7 days gap should be needed. Okay, then in after vamana karma, if you wanted to do niruha basti, then you should keep a gap of 16 days. Okay, so vamana ke 16 din. So the first of all, if you are doing vamana, then followed by if you wanted to do niruha basti, so 16 days gap should be needed. Then after niruha basti, if you wanted to do anuvasana basti, so on that day itself we can do it. So after the niruha basti, that fatigue or weakness of the niruha basti, like after niruha basti, the patient will be feeling little bit tiredness will be there. So when they are getting the bala, so maybe that evening or maybe next day we can do anuvasana basti. ओके, सो निरूह के तत्काल पश्चात अनुवासना दिया जाना चाहिए. सो लाइक आफ्टर द निरूह बसी वी कैन डू अनुवासना बसी. देयर इज नो नीड ऑफ ए गैप. Okay, so after vamana 15 days gap of virejana we can do. After virejana 7 days we can, after doing virejana karma, leave a gap of 7 days, then we can do anuvasana basti. After vamana 16 days gap, then we can do niruha basti. After niruha then we can do anuvasana basti. Anuvasana basti hedu shreshta kala. So which time we have to do anuvasana basti? That is pradosha kala. Okay, evening time is good for the anuvasana basti. Astavana basti hedu shreshta kala, that is madhyana kala. So astavana basti has to be done in the madhyana, in the afternoon time we have to do astavana basti, that is good time. Then vamana virejana hedu shreshta kala is purvana. In the early morning you have to do vamana and virejana karma. So these are the timings of the each shodhana karma. Then basti pratyagamana kala, very important. So astabana basti, after doing the niruha basti, at how much time the patient has to hold the basti? That is 1 muhurta. Okay, so that much time only we can hold it. So before that astabana basti has to come out. Okay, so more than that, if astabana basti is staying in the body, it will create complications. Okay, so maximum maximum duration we can hold astabana basti is 1 muhurta. Okay, so before before that itself we have to remove the basti from the body. Okay, maximum time period is 1 muhurta or 48 minutes. Okay, after that after 1 muhurta also astabana basti it is not coming out, then it will create complications. So that time you have to go for other tikshna basti or phalavarti prayoga. So this type of treatment you have to done, and you have to remove the basti from the body. That kashaya basti dravyas. Okay, so basti pratyagamana kala of astabana basti is 1 muhurta. Anuvasana basti is 3 yama. Okay, 9 hours. Okay, 9 hours is the 3 yama, that is a time duration for the anuvasana basti. That much time you have to hold the anuvasana basti, because we are introducing the thaila or grida to the body, so it will absorb, like that body will be absorbing. So that much time is needed. Okay, before that it is coming out, then it is because that much time if you hold it, that is good for the body. Okay, so maximum retained period for anuvasana basti is 3 yama and astabana basti is 1 muhurta. Then anuvasana basti bhojan ke turant paschat deya. So after eating the food you have to take anuvasana basti. Okay, so anuvasana basti should not be taken in empty stomach. Always the patient should have some food, and then followed by the patient has to take anuvasana basti. So after the food we have to take anuvasana basti. Astabana basti every time you have to take it in the empty stomach. Nirahara or bhojan ke jeerna hone par there. So in the empty stomach you have to be given, or otherwise after the end of the digestion, like the full digestion of the food has taken place, then only you have to give astabana basti. Okay, then snehana nasya matra. So Pradama, like first day 8 bindu, and then second day is Shukti Pramana, which means 32 bindu, and in the third day Pani Shukti, that is 64 bindu. This is the dosage of the Snehana Nasya in the first, second and third day, 8 bindu, 32 bindu and 64 bindu. Then Shiro Vairejana Sneha Matra is 468 bindu. Okay. For Shiro Virejana, if you are giving Nasya, then the dosage should be 468. In this order, you have to give Shiro Virejana Nasya first, second and third day. Then Pradimarsha Nasya Kala is 14. Okay. Pradimarsha Nasya Kalas are 14 according to Sushruta, 15 according to Vakbhatta. Then Pradimarsha mein dosha anusar Sneha Prayoga. So if it is a Kapha Yukta Vada dosha is there, then which Sneha has to be used for Pradimarsha? That is Taila. Okay, if a patient is having some disorder or patient's prakriti is Kapha and Vada predominancy, so if you wanted to give Pradimarsha Nasya, so you should take Taila as Pradimarsha Nasya. If it is a Pitta Pragoba condition, Grida has to be taken as Pradimarsha. Vada Pragoba Vasa. Vada Pitta condition, Majja has to be taken. So these are the Sneha should be taken for Pradimarsha in each dosha predominant condition. Then Kabala types. Okay. Kabala that we can correlate with a gargling. Okay, Sanjari. So that is 4 types are there: Vadiga, Paitiga, Sleshma and Vrana. Okay, for Vadiga we have to do Snehana Kabala. For Kafaja, Shodhana Kabala. For Paitiga, Prasadana Kabala. And for the Vrana, Robana Kabala. So these are the 4 types of Kabala based on the dosha. For Vadiga, Snehana Kabala. For Slaishmiga, Shodhana. For Paitiga, Prasadana. For Vrana, Robana Kabala has to be given. Then Pradisarana, that is also 4 types are there. Okay. So according to Sushruta, 4 types: Kalka, Rasakriya, Kshaudra, Churna. So these are the 4 types of Pradisarana according to Sushruta. According to Sharangadara, Pradisarana is 3 types are there: Kalka, Avaleha, Churna. Okay, so these are the 3 types of Pradisarana according to Sharangadara. Next one is Dushi Visha Lakshana. Okay, Dushi Visha Lakshanas, it is similar to the Lakshanas of the Dushyodara. Okay, whatever symptoms you are getting in the Dushyodara, the same Lakshanas you can see in the Dushi Visha. Okay, Dushyodara means Sannipadaja Udara. So Dushi Visha means it is a toxic substance. Okay, it is a poison, but it is a Visha. What happened means that virya has become lost. Okay, it is a toxic substance because of the exposure to the sun, because of the exposure to the wind, and because of the long time it is staying in the soil, and because of that what happened, its potency will become losing. Okay, so the potency has become lost, and because of that what happened, it will create a slow and chronic damage in your body. So that is called Dushi Visha. So Dushi Visha means here the Visha will become Gunahina. Okay, so the Visha, the potency has become lost because of what? Because of the exposure to the sun, exposure to the fire, okay, exposure to the wind, and because it is staying in the staying for a longer period. Okay, like Jeerna, because of the because of the time being that digestion, or there is a paga will be happening. Okay, because of all these things what is happening, that virya of the Visha is getting losing. So that Visha, if you are taking in your body, what happen? It will stay in your body and it will create damage, chronic damage will be creating. And whenever there is a particular time will be coming, particular season will be coming, or particular food you are taking, what happen? The Visha Lakshanas will be started to exposing. So that is called Dushi Visha. Okay, so here in Dushi Visha, what is happening? Because of the Jeerna, because of the exposure to the natural things. Okay, so because of that, there will be Gunahina, the potency of the Visha will become loses. Okay, so because of that what happened, it will retain in the body for a longer period and it will create chronic damage. And whenever there is a time is coming, okay, which means maybe because of the Kala, or because of the Anna, or because of if you are going to some of the places, okay, so such time what happened, this will get trigger in your body and it will create Visha Lakshanas. So that is called Dushi Visha. It is also known as Varsha Gana Anubandhi. Okay, that is one of the feature of Dushya Visha, Varsha Gananubandhi, which means every year or at a particular time period, the poison will be started to exposing. Okay, so that type of Lakshana you can see. It will stay in your body as it is and it will create Visha Lakshanas. So when the time is coming, so that time they will be started to exposing the Visha Lakshanas and then it will get subside and again it will reoccur. Okay, so that is called Varsha Gananubandhi. So that is happening because of the Alpavirya. Okay, so what are the Lakshanas they will be showing? So the Lakshanas of the Dushyodara Lakshanas they will be showing. Okay, if the patient is having Dushya Visha in your body, so Lakshanas similar to the Dushyodara Lakshanas will be showing. Dushyodara means Sannipadaja Udara, like Vada Pitta Kapha, Tridosha symptoms will be there. Tridoshaja Udara symptoms you can see in Dushya Visha. Then Dushya Visha Karya. Okay, because of the Dushya Visha, what disorder you can get as a complication, what you will be getting? That is Dakodara. Dakodara means Jalodara. Okay, like a fluid accumulation in the abdomen, ascites condition. Okay, if you are not treating properly Dushya Visha, it leads to Dakodara or Jalodara. Dushya Visha Lakshanas, it is similar to the Dushyodara Lakshanas. And because if you are not treating properly, it leads to the next condition called Dakodara. Okay, which means Jalodara. Next one is Sarpa Visha 7 Vega Lakshanas. Okay, in Pradama Vega Rekta Dushti is happening. In Dvidiya Vega Mamsa Dushti is happening, because of that Shodha will be getting. And Tridiya Vega Meda Dushti. And in Chadurtha Vega Visha Koshta me Asra. Visha will be reaching into the Koshta Pradesha. And in the 5th Vega it reaches in the Asti. Okay, in the 4th it reaches Koshta, then in the 5th it reaches the Asti, and then it leads to the Prana Agni Dushida. So Prana is getting vitiated, Agni is also getting vitiated when it is reaching the Asti Pradesha. Then in the 6th Vega it is reaching into the Majja and it leads to the Grahani Dushida. Then in the 7th Vega it is reaching in the Shukradadu and it leads to the Vyana Vayu Pragoba. So these are the things will be happening when the Sarpa Visha enters in your body. Okay, so these are the 7 Vegas of the Sarpa Visha. Rekta Dushti, Mamsa Dushti, Medo Dushti, then Visha will be reaching in the Koshta, then Asti, then Majja, then Shukradadu. This is the way how the Sarpa Visha will be enters in your body. Then next one is Pashu Visha Chikilsa me Aushadha Matra. So in the Mriga Ayurveda, like for animals, if the animals are getting Visha, then how much dosage of the medicine we have to be given. So Bakari Va Bhed me Manusha Sadrisha. So if the sheep or goat, if they are getting poison, what is the dosage we are giving for the human being? The same thing you can give. Goda Va Gaye me. So horse or cow. Okay, horse or cow, for them 2 times of what is the dosage we are giving for the human being. So 2 times of that we have to be given for the Goda and Gaya. Okay, horse or cow. Next one is Bhames and Oont mein 3 guni. Okay, that is buffalo and camel. Sorry, buffalo and cat. Okay, buffalo and cat, for them. Sorry, Oont is camel only. Okay, Oont is camel. Bhames is buffalo. So buffalo, camel, for them 3 times of medicine has to be given. Then Hathi mein 4 guni. So in elephant 4 times. Okay, so this is the Aushadha Matra for the animals. 2 times for the horse or cow, camel and buffalo, for them 3 times. Then in the elephant 4 times of the like whatever dosage you are giving for the Manusha, so for that 4 times you have to give for the elephant. So these are the Aushadha Matra for the Pashu Visha. प्रमुख विषाक्त जीवा व उनसे दष्ट होने पर लक्षण. So we can now we are going to see the different type of visha lakshanas. Okay, so if the Kanabha visha has entered in your body, then you will be getting Tivra Vedana, severe pain will be there. Then Galagoliga, that visha is entering in your body, then you will be getting Hridaya Pida, Adisara, there will be discomfort in the chest region and Adisara will be there. Manduga visha is entering in your body, Mukha se Pida Fena Pravarti, so you will be getting yellowish froth discharge will be coming from the mouth. Okay, if Manduga visha, frog, if that visha is entering in your body, From the mouth you will be getting pida fena, yellowish type of frothiness will be coming out. Pipilika, then Agni Dagdavat Pida. Okay, you will be getting burning sensation like a fire burn type of burning sensation will be getting. Krikalaka, Purisha Bheda, which means Adisara. Okay, if Krikalaka Visha is entered, then you will be getting Adisara. Uchittinga, it leads to the Stabda Linga, the stiffness of the penis will be there. Griha Godiga, it leads to Sweda Adipravarti. There will be excessive sweating will be getting. So these are the lakshanas you will be getting due to the Dashta lakshana. If Kanaba is biting, then you will be getting Tivra Vedana. Galagoliga is biting and Visha is entering. Hridaya Pida Adisara will be there. Manduga Visha is entering, then it leads to Pida Fena Pravarti. Pipiliga Agni Dagda Vatpidha, Krikaliga Purisha Bheda, Uchittinga Stabda Lingada, Griha Godiga Sweda Adi Pravarti. So these are the Visha Lakshanas you will be getting. Next one is Gara Visha Lakshana. So Gara Visha Lakshana means it is a combination of the Nana Prani Angashamala. Okay, so we are combining so many things together. Okay, Nana Prani Angashamala. So the waste materials of the many many pranis we have to taken. Okay, like many insect or many type of animals, mala has to be taken. Then we are mixing with the Viruddha Aushadhi Bhasma. Okay, combination of Nana Prani Angashamala, Viruddha Aushadhi Bhasma, then Alpa Virya Visha. Okay, we are combining all these vishas together. Like we are creating one new visha, Kritrima visha we are creating. Okay, so this is called as Gara visha. So it is a combination of Nana Prani Angashamala, Viruddha Aushadhi Bhasma, Alpa Virya visha, that is called Gara visha. Okay, so if the Gara Visha is entering in your body, it will not kill the person very easily. It will take little time, like slowly, like slow poison. Slowly only the patient will die. Okay, so it is a Kalandara Vipaka. Kalandara Vipaka, like slowly only its effect will be coming, and slow death, like maybe it will take 1 or 2 months the patient will die. Okay, so in Gara Visha, what are the lakshanas you will be getting? Krishna Vyakti Swapna mein apne ko Gaura Varni va Gaura Vyakti apne ko Swapna mein Krishna Varni dekhta hai. Which means if a black person, okay, if that person will be seeing one dream, in that he will be seeing as a fair person. Okay, if Gara Visha entered his body, the black person sees, like black person will be dreaming. Okay, while dreaming, he sees that he looking like a fair person. And if a fair person has got Gara Visha, and he will be seeing the dream, in that he sees that he has become blackened. Okay, Gaura Vyakti apne ko swapna mein Krishna Varni dekhta hai. So fair person will be looking as a black person will be looking as a fair person, like that of dream that patient will be looking. So that is one of the lection of Gara Visha. Then Gara Visha Chigilsa, according to Charaka, Tamra Churna se Vamana, Tadanandar one Shana ki matra mein Swarna ka sevana karave. So first of all, take Tamra Churna. With the Tamra Churna, we have to do Vamana Karma. After the Vamana Karma, one Shana Swarna has to be taken. Very, very important. Okay, so Swarna that is indicated in the Gara Visha. So how much dosage you have to take it? One Shana Pramana. That always they used to ask. Okay, so first of all in Gara Visha we have to do Vamana Karma. Vamana Karma how we have to do? By using Tamra Churna. Okay, so Tamra Churna mixed with the Kshaudra you have to be taken. So after that doing, then you immediately should take one Shana Swarna has to be taken. Okay, so that is an important treatment for the Gara Visha Chikilsa. Okay, so one Shana Swarna, that is very, very important. Okay, that is indicated in the Gara Visha Chikilsa. Then Vaidurya, Hira, Panna. Okay, this type of this is also Vishanashaka. Okay, this type of this metals, all those things. Okay, Vaidurya, Hira, Panna. So this type of metals also has Vishanashaka property. Then स्वर्ण सेवन किए व्यक्ति पर विष का प्रभाव उसी तरह नहीं होता है जैसे कमल के पकूड़ियों पर जल रुक नहीं पाता है. So this is a statement which is told by Charaka. If you are taking swarna, okay, after doing the Vamana karma, if you are taking swarna, then that person will become very clean, which means that person will not get any visha in their body. Okay, like the lotus petals are there, no? In the lotus petals, if you put a drop of water, how it will not that it will be flowing from the that lotus petal, no? It will not stay in that petal. Right, it will be moving here and there, and it will go. The petals will not absorb the water. In the same way, after taking the swarna, your body will become very pure, so the visha effect you will not get again. Okay, so that is the importance of the intake of swarna in the Garavisha Chikitsa. Okay, so like how the lotus petals are not receiving the water. If you put water droplets, it will go from that petal. Okay, it will not stay in the leaves. So in the same way, if you take swarna, the body will become clean. If in case if any visha is entering in your body, it will not affect your body. Okay, so this statement is told by Charaka in Gara Visha Chikitsa. So that much importance is there for the intake of swarna. Next one is Asadya Vishakta Jiva, which means we have seen different types are there, no? Galagolika, Mashaga, like that we have seen different types are there. In that particular types it is Asadya. In Galagolika, Sarshapika variety is Asadya. In Makshika, Sthaliga, Kashayi, this type of Makshikas are Asadya. In Mashaga, Parvadiya Namaga, Mashaga is Asadya. Then Goderaga, Shveda, Agni Prabha, Brukudi, Kotika, this type of if this type of vishas are Asadya. Okay, this type of vishas are entering in your body, it is Asadya. Okay, these are Asadya categories. Okay. Next one is Vrishchiga. Okay, Vrishchiga, totally 30 Vrishchigas are there. Okay, total 30 Vrishchigas are there, and this total 30 is divided into 3 types. Manda Visha, Madhyama Visha and Tivra Visha. Okay, Vrishchiga totally 30 in number. It is divided into 3 types: Manda Visha, Madhya Visha and Tivra Visha. Manda Visha 12 in number. Manda Visha 12, Madhya Visha 3, Madhya Visha 3 and Tivra Vishas are 15. Okay. Manda Visha 12, Madhya Visha is 3 and Tivra Visha is 15. Manda Visha means the Vrishchiga which is originating from Gavadi Shakrut Kota. Gavadi Shakrut Kota, which means from the cow dung of the animals. Okay. Waste material of the animals like cow dung. Okay, from the cow dung if Vrishchigas are originating, so that is called as Manda Visha. Gavadi Shakrut Kota. Madhya Visha is Digda Dashtadi Kota. Digda Dashtadi Kota. Digda Dashtadi Kota means from the decayed wood. Okay, decayed wood. WOOD. Decayed wood. Okay, so decayed brick. Decayed brick. Okay, so decayed wood or decayed bricks, from that Vrishchiga is entering, originating, so that is called as Madhyama Visha. Tivra Visha is Sarpa Kodashcha Sambhuda. Sarpa Kodashcha Sambhuda. From the decomposed matter of the snake. Okay, Sarpa. Okay, from the decomposed snake, from that Vrishchiga is originating, so that is called Tivra Visha. Okay, so these are the 3 types of Visha. Manda, Madhyama, Tivra, based on the which part this Vrishchiga Visha is originating, according to that 3 Vishas are the 3 Vrishchiga Visha: Manda, Madhyama and Mahavisha, or Mahavisha, or otherwise known as Tivra Visha. So Manda Visha Anega Parvavala, so multiple joints are there. Okay, multiple joints are there in Mandavisha. Dahava Shodhakaraka. If Mandavisha is biting you, then it will create burning sensation, swelling will be getting. Madhyama Visha is Teen Parvavala. So, three joints will be there in the body. In Madhyama Visha, three joints will be there and it is color will be Krishna Varna, black in color. And if the Madhyama Visha is affecting in your body, then Jihva Shodha Mala Avarodha Karaga. So, there will be swelling in the tongue and there will be severe constipation will be getting. So, these are the features of the Madhyama Visha. तीव्र विष वन या दो पर्वयुक्त या पर्वरहित नाना वर्णी नासा व रोमकूप से रक्त प्रवृत्ति कारक. If it is a तीव्र विष, how we can come to know? So that Vrishchika will be having one or two joints, okay, or otherwise there will be no joints in the body. Okay, so how we can identify the Tivra Visha means in the Vrishchika will be having one or two joints will be there in the body, or otherwise there will be no joints. Okay, and there will be different colors will be there in the body. And if that is biting in your body, so the Visha will be entering, then you will be getting bleeding from nostrils and from the hair follicles. Okay, Nasa, Roma, Kuba, from all these areas you can get bleeding. If Manda Visha is getting, then Daha, Shodha will be there. If Madhyama Visha, Jihva, Shodha, Mala, Avarodha, Karaka. So there will be swelling in the tongue and there will be constipation will be there. So these are the clinical features of the each Vrishchika Visha. Next one is Adimanda. Adimanda, it comes under the Shalakya Sarvanga Netra Roga. Okay. So it comes under the category Sarva Netra Roga. So Adimanda, it is classified into different types: Vadaja, Pittaja, Kafaja and Rektaja Adimanda. Okay, so in Adimanda basically you will be getting severe churning type of pain will be getting in the eyes. Okay, churning type of pain you will be getting in the eyes, that is called Adimanda. So in Vadaja Adimanda, what is the Lakshana you will be getting? Madhyade Arani Vachayat, then Shiraso Ardanja. So here Madhyade Arani Vacha means like eye has become forcefully removed from the eyeball. That much pain will be getting. Okay, so the patient will be feeling that eye has become removed from the eye socket. So that type of pain will be there. Shiraso Ardanja, the half of the head will be feeling severe pain. These are the symptoms of the Vadaja Adimanda. Then Pittaja Adimanda, Rektaraji Jidam Sravi Vannineva Avadahyade Yakrit Pindobamam Ksharena Aktimiva Dahe. So Rektaraji Jidam Sravi, there will be red color lines you can see in the eye region. Okay, and Sravi, there will be discharge will be there. Vannineva Avadahyade. Okay, so the eyes will be like a burning sensation will be there. Okay, burning pain will be there. Then Yakrit Pindobamam, eyes will be looking like a Yakrit. Okay, like a liver, a piece of the liver, how it will be, in that way eye will be looking. Okay, so Vannineva Avadahyade means burning sensation. The eyes will be having severe burning sensation like a fire burn. Okay, that type of burning sensation will be there. Eyes will be looking like a piece of liver. Okay, Yakrit Pindobhavam. Kshare Naktimiva Dahe. There will be another type of burning sensation you will be getting, like it is eyes have got alkali, like Kshara has become felt in your skin, then you will be getting burning sensation. So that much pain you will be getting. Okay, in Pittaja Adimanda, you will be getting burning sensation that will be similar to that, like a fire burn, or there is a Kshara has fallen your body. So that time how much pain you will be getting, that type of pain you can see in Pittaja Adimanda. Then Kafaja Adimanda. So here Nasa Atmana Pamshu Purna Ivam Avilam. Nasa Atmana, there will be like swelling in the nose will be there. Inflammation of the nose will be there. Pamshu Purnam Iva Avilam. Like eyes will be seeing, like like if you are seeing something, so that objects will be covered with a dust type of things you can see, like Avila Darshan. It is not a clear vision, and whatever objects you are seeing, that objects is filled with a dust particle, like that false image you will be getting. Okay, Pamshu Purnam Iva Avilam. Okay, you are seeing the particles, whatever objects you are seeing, in all the objects you can see so many dust particles are there. Like that of vision you will be getting in case of Kafaja Adimanda. Then Rektaja Adimanda, Bendu Jiva Pratikasham, Sparshanaksham, Rektamakna Arishtavat Shukla Bhagascha Lekshyade. Okay, so Bendu Jiva Pratikasham, the eye will be looking like a severe reddish discoloration, like a Jaba Kusuma, like a hibiscus flower is there, no? So that type of severe reddish discoloration you can see in the eyes. Thus, Sparshanaksham, there will be severe tenderness will be there. Okay, Rekta Makna Arishtavat Shukla Bhagascha. So there will be the Shukla Bhaga, the white color portion is there, no? So that white color portion will be looking like a, it is immersed in the blood. Okay, like that Arishta means it is a seed. So if that Arishta is dipping into the blood, how it will be looking, in that way the Shukla Bhaga will be looking. That much reddish discoloration will be there in the sclera part. Okay, so eyes will become red, looking like a this hibiscus flower. Okay, that type of reddish discoloration will be there. Or if you are immersing the Arishta in a blood, so how it will be looking, so that that type of color discoloration you can see in the Shukla Bhaga. Then tenderness of the eye, these are the symptoms of the Rektaja Adimanda. Then additionally Vagbhata has mentioned one symptom for Kafaja Adimanda, that is Nadam Krishna Munnadam Shukla Mandalam. So there will be depression of the Krishna Bhaga and elevation of the Shukla Mandala you can see in the Kafaja Adimanda according to Vagbhata. Okay, Nadam Krishnam Unnadam Shukla Mandalam. So Krishna Mandala has become depressed and Shukla Mandala will become elevated. So like that of differentiation you can see in Kafaja Adimanda. Then Kevala Lekhana Karma Yogya Roga. So only Lekhana Karma is indicated in some of the eye disorder. Which are the condition? Shyava Vartma, Kardama Vartma. Okay, in Shyava Vartma, Kardama Vartma only Lekhana Karma is indicated. Chedana Purvaga Lekhana Yogya Roga. First of all we have to do Chedana Karma, then followed by you have to do Lekhana. That is indicated in Utsangini Kumbiga Vartma Sharkara. Okay, only Lekhana, Shyava Vartma, Kardama Vartma. First of all you have to do Chedana, then followed by Lekhana, that is indicated in Utsangini Kumbiga Vartma Sharkara. Then Pitta Vidagda Drishti, in that condition Triphala Grida is indicated. Sleshma Vidagda Drishti, in that condition Trivrit Grida is indicated. Next one is Pradishyaya Lakshanas. So Vadaja Pradishyaya. In Vadaja Pradishyaya there will be like Pradishyaya we can correlate with the rhinitis condition. So there will be discharge will be there. So in Vadaja Pradishyaya Tanusrava Pravartini Galatalu Oshta Shosha. So there will be thin discharge will be coming. So it is a Vada Pradhana Pradishyaya, it is happening in your body. Then the discharge which is coming from the nostril, that will be very thin discharge. Okay, and there will be dryness you can feel in the Gala Talu Oshta Pradesha. So these are the symptoms of the Vadaja Pradishyaya. If it is a Pittaja Pradishyaya, Saduvam Sahasa Vanim Vamadim Cha Manavaha. So there will be burning sensation will be there. Along with the discharge, there will be severe burning sensation, like a smoky type of sensation will be there, or fire burn type of burning sensation will be there. And Vamana, there will be vomiting sensation. These are all you can see in the Pittaja Pradishyaya. Okay, so burning sensation with the rhinitis, that is Pitta predominancy. Tanusrava Pravartini is Vadaja Pradishyaya. Then in Kafaja Pradishyaya, Shunaksho Galatalu Oshta Kandu. Shunaksho, there will be swelling in the eyeball area you can see. Then there will be severe itching sensation in the Galatalu Oshta. Then that is Kafaja Pradishyaya. Then Sannipadika Pradishyaya, Bhutva Pradishyaya Yo Akasmat Nivartande. So in Sannipadika Pradishyaya what is happening means, sometimes there will be increased symptoms of the Pradishyaya will be there, and sometimes there will be decreased symptoms will be there. So there is a fluctuation of the symptoms you can see in the Sannipadika Pradishyaya. Then in Raktaja Pradeshaya Tamra Akshasha, there will be copper color will be there in the eye. If it is a Raktaja predominant Pradeshaya, coppery color you can see in the eye region. Gandhana Veti, there will be no smell. Okay, the person will be suffering with the loss of smell. Krimi Murda Vigarena, like Krimija Shiroroga, that type of lakshanas you can see in the Raktaja Pradeshaya. Then Dushta Pradeshaya Lakshana Praklidyade Punarnasa Upanascha Parishusyade Muhur Anahyade Cha Abhi Muhur Vriyade. So there is sometimes there will be moistness you can feel in the nostril, and sometimes there will be dryness will be feeling. Okay, moistness, sometimes you can feel there is moistness in the nostril, and sometimes you will be feeling dryness of the nostril. Okay, and sometimes you can see there will be swelling in the nostril, and sometimes there will be no swelling. Like that, intermittent symptoms you can see in the Dushtaja Pradeshaya. So these are the lakshanas or main lakshanas of the each Pradeshaya. Next one is Panjasara. So what you call as Panjasara, that is the Dugdha, Sharkara, Pippali, Shahad and Grida. These 5 things are togetherly called as Panjasara. Shahad is honey, Madhu. Okay, Madhu. Dugdha, Sharkara, Pippali, Madhu, Grida. These 5 togetherly we can call it as Panjasara. Then Adhisara Lakshana. Okay, in Pittaja Adhisara, Vegan Mamsa Toya. So there will be excessive, Vegas will be coming, and the discharge will be looking like a Mamsa Toya. Okay, meat washed water, that type of color you can see. Meat washed water, that type of discharge you will be getting in Pittaja Adhisara. In Kafaja Adhisara, Vega Shangi, Srishta Vitko Abhibhuyaha, Nisvanaha, Hrishtaroma. Vega Shangi means the patient will be feeling urge for passing the stool, like urge will be there. Okay, Srishta Vitko Abhibhuyaha. So there will be, he will be passing the stool, but in a very small quantity will be passing. Okay. Then Nisvanaha Hrishtaromaha. There will be horripilation will be there. Okay, horripilation will be there. So these are the symptoms of the Kafaja Adhisara. Vega Shangi, Srishta Vitko Abhibhuyaha, Nisvanaha, Hrishtaromaha. Okay, so there will be this urge will be there, and whenever they are passing, there will be small stools will be passing, and there will be horripilation will be associated. So these are the lakshanas of the Kafaja Adhisara. Then Shogaja Adhisara. Okay, in Shogaja Adhisara, Kakanandi Prakasham. So the Adhisara, the color will be looking like Kakanandi. Sa Gandham Nirgandham Va. So there will be foul smell will be there. Sometimes there will be no smell will be there. So these are the symptoms of the Shogaja Adhisara. Then Durnivaraniya Roga, like very difficult to treat. Okay, according to Sushruta, Shwasa Kasa Vilambika. So these 3 conditions are difficult to treat according to Sushruta. Then Pradimashanasya Kala, according to Sushruta 14, according to Vakbhata it is 15. Then dosage of the Pradimashanasya is 2 or 1 bindu. Okay, 2 bindu is the normal dosage. Then Ratri mein Nasya Karma ka Nishe. So in the night time Nasya Karma is contraindicated. Then Ojakshaya. Ojakshaya you can see in which all the conditions. Madhumeha, Grahani, Kshadakshina. In these 3 conditions we will be getting Ojakshaya. Then Sushrudane Andhra Vriddhi ko Asadhya Vyadhi Mana hai. So according to Sushruta, Andhra Vriddhi is a Asadhya condition. Then Vishaduro mein Svedan Nishiddha Mana hai. Those who have taken poison, okay, for them Svedana is contraindicated. Okay, but Kita Visha Dushi Visha. In these 2 conditions you can do Svedana Karma. Rest of the Vishas you should not do Svedana Karma. It is contraindicated. Then Luda Visha में Vamshatvagadi Agada देते हैं. So in Luda Visha Vamshatvagadi Agada is indicated. Ushna Virya Himasparshi is Amla Rasa. Okay, Amla Rasa, the sour taste, it is having Ushna Virya. While touching it is very cold in sensation. Okay, so that's why Ushna Virya Himasparshi, that is a property of Amla Rasa according to Vakbhata. Then plague ki jadi hai Kandira, like a antidote for plague. Okay, that is Kandira. Antidote for plague disorder, it is Kandira. Then Sarva Dosha Pragobhaga Ridu is Varsha Ridu. In Varsha Ridu, full Tridosha is getting vitiated. Okay, Sarva Dosha Pragobhaga Ridu is Varsha Ridu. Then Vishama classification according to Charaka, Shusruta, Kashyapa, these Acharyas are all Vishama types. They have mentioned 5 types. Then Vandya Stri Bheda, types of Vandya according to Harida 6, according to Rasrakna Samuchaya is 9. Then Charagajarya Upadi Di Gaihe. So like the title Charagajarya that is given for Dharmadasa Vaidya. Okay. So this Dharmadasa Vaidya, for this person the title Charagajarya has given. Like Charagajarya, like the title has given to Dharmadasa Vaidya. Then Ayurveda ko Shodashanga mein vibhakti kiya. Like Jagannatha Prasada Shukla, he has considered as a Shodashanga Ayurveda. Okay, Ayurveda is considered as a Shodashanga according to Jagannatha Prasada Shukla. Then Goraksha Samhita, it is written by Shada Sahasri. Then Agneya Ayurveda, it is written by Gangadhar Roy. Then Vakbhatane Snehika Sarvasreshta Anupana Mana hai Laja. Okay, according to Vakbhata, the best Anupana for Sneha is Laja. Then Sushruta ne Karshu evam Kupa Sveda Nahim Bataya hai. So Sushruta has not mentioned Karshu Sveda and Kupa Sveda in Agni Sveda. Okay, Karshu, Kupa, these are all mentioned by Charaka. Gadodvega, Tandava Roga, Urastoya, Aubasargiga Meha, Kanjanika, Evam Kloma Roga, these are all mentioned by Govinda Sen. Okay, these type of conditions are all mentioned by Govinda Sen. Nabi Kundala, this condition is mentioned by Rasrakna Samuchaya. Then Sadamshi Jadaharini, that we can consider as a Parigarbhika. So Parigarbhika means it is a condition, it is a malnutrition disorder which is affecting to the baby. Okay, so baby is doing mother is doing the breastfeeding. Okay, so during the breastfeeding time, if the mother is again conceiving, again the mother is getting pregnant, then what happen? So that breast milk will become reduced. So the baby is not getting the proper breast milk, and very easily that solid food particles are getting introducing. So because of that, what happen? Malnutrition will be getting to the baby. So that is called Parigarbhika. Okay, so the breastfeeding mother is getting pregnant again. So because of that, what happened? The baby is not getting the proper nutrition. Why? Because of the pregnancy, the breast milk is getting reducing. So the proper breast milk is not getting, and very easily the baby is introducing to the solid materials. Okay, solid food the baby started to eating. So because of that, what happened? Proper nutrition is not getting, it leads to malnutrition so to the baby. So that condition is called Parigarbhika. So the same condition we can in Kashyapa, he has mentioned Jadaharini, no? So in the Jadaharini category, Samdamshi Jadaharini, it is similar to the Parigarbhika. Okay, in Samdamshi Jadaharini, the same thing is telling the mother is the breastfeeding mother is getting pregnant again, and because of that the baby is not getting the breast milk is not getting properly. So through that way the baby will be suffering with the malnutrition, or baby will die because of the proper breast milk is not getting. So this condition is called as Samdamshi Jadaharini. So this Jadaharini we can correlate with the Parigarbhika. Both are almost a similar condition. Okay, so it is a malnutrition disorder. Then Pishaji Jadaharini. Okay, so that we like a Kamala Roga you can see. Okay, like Kamala Roga, how it is happening, in the same way Pishaji Jadaharini we can correlate. Then the Sambat, total 15 qualities are there. Aprashasta Danda is 5 are there. Then Putra Janani, it is a paryaya of Lakshmana. Okay, it is a Lakshmana drug synonym is Putra Janani. Then Navayasa Loha mein Ghadagon ki sankhya va anupana. So how many ingredients are there in the Navayasa Loha? That is 10. Okay, 10 ingredients are there. Anupana is Madhu and Grida. Kala Mekha Navayasa Loha, that is described by Yadavji Acharya. Okay, Yadavji Acharya has described the Kala Mekha Navayasa Loha. Then qualitative and quantitative analysis. So that Samprapti type, different type of Samprapti we have studied, no? So in that qualitative quantitative analysis, so this description is similar to the Vikalpa Samprapti. Okay, Vikalpa Samprapti, it is also known as qualitative and quantitative analysis of the disorder. Then Shugadanya types are 15 are there. Okay, then Shahad Sevanaka Nirdesh, which means Madhu when we have to take it, that is in Varsha Ritu. Then Manda Sevana is indicated in Grishma Ritu. Then Shivadasan, he has written some commentaries, okay, based on the Samhita. So he has written a commentary based on Charaga Samhita, that is called as Charaga Tattva Pradipika. Okay, Charaga Tattva Pradipika. Then Shivadasan written a commentary based on the Chakradatta Samhita, that is Tattva Chandrika. Okay, that commentary book name is Tattva Chandrika. On Ashtanga Hridaya also, Ashtanga Hridaya Uttara Tantra. Okay, for that he has written a commentary that is called Tattva Bodha. Then on Rasarakna Samuchaya he has written one commentary that is called Tattva Bodhini. So these are all written by Shivadasan. Charaga Tattva Pradipika based on Charaga Samhita, Tattva Chandrika based on Chakradatta, Tattva Bodha based on the Ashtanga Hridaya Uttara Tantra, Tattva Bodhini it is based on the Rasarakna Samuchaya. Then Vrinda Madhava, he is a 8th century AD, he was living. So he has described some Krimi Roga like Snayuga Roga, Parashika Yavani, this type of Krimi Roga is mentioned by Vrinda Madhava. Then Shodala, he has mentioned Arka Kalpana, Kumari Asava preparation, these are all mentioned by Shodala. Yoga Ratnagara, he was living in 17th century AD. So he has described Shida Prameha, then Ulfullika, Mandaraswara, then Bhimaseni Kapura. This type of Netra Rogas are mentioned by Yoga Ratnagara. Okay, Shida Prameha he has mentioned, Ulfullika he has mentioned, Mandaraswara, this type of disorders he has mentioned. Then Bhimaseni Kapura type of one Netra Roga is mentioned by Yoga Ratnagara. Then Bhava Pragasha, he has given a name for Hamsodaga, that is called Amshudaga. Okay, Hamsodaga we have studied in Ashtanga Hridaya. So for Hamsodaga he has mentioned the term Amshudaga. Then Raja Nikhandu. Okay, Raja Nigandu, Abhidana Chudamani, these are all written by Narahari. Nikhandu Shesha, Abhidana Chindamani, that is written by Hema Chandra Krita. Hema Chandra Krita. Then Shastra Anushastra mein Shreshta Kshara. Okay, most important Shastra and Anushastra is Kshara. Anushastra mein Shreshta is Jaloga. Then Talupada, it is a Shalakya disorder, Kandaroga. So in Talupada, that is described by Susruta, it is a Vadaja predominant condition. So here Mastulunga Kshaya is happening. Okay, Mastulunga Kshaya is happening, due to that you are getting Talupada. Talu Kandaga, this is described by Vagbhata. He has mentioned it is a Kafaja predominant condition. So here Sthanapana is Nishida. Stanyapana is contraindicated in Talu Kandaga. Then Shalya Chigilsa Guna is 6. Okay, for a good surgeon we should need 6 qualities should be needed. Then Kumaragara Varnana. Kumaragara is a playing room for the kids. Okay, playroom. So that playroom how it should be there. Okay, like what are the things should be required in the playing room. All the things are described by Charaga and Ashtanga Sangraha. Then types of Sannipadiga Jwara, according to Charaga 13, according to Kashyapa 13, according to Sushruta it is only 1. Pagal Kutteki Jadi, like antidote for the rabies, mad dogs are there, no? Mad dog. For them antidote is Neelika. Okay. Then Kshara Nirmana has to be done in Sharat Ritu. Then Harida Samhita ka Vastaviga Nama, like the real name of Harida Samhita is Vaidyaga Sarvasva. Okay, Vaidyaga Sarvasva, this is the name of Harida Samhita. Then Tulasi, that term has mentioned by Ashtanga Sangraha. Then Sarvartha Siddha Anjana, this is mentioned by Vagbhata. Then Dhadu Omim Yeshadika Varnana Sarva Pradama Sharangadra mein aaya hai. So in the classification of Dhadu, in that Yeshada will be coming. So that is described by Sharangadara. Then in Bhaishyaja Ratnavali 4 sthanas are there. Total 216 chapters are there. Okay, and Bhaishyaja Ratnavali it is written by Govinda Sen. Okay, so Bhaishyaja Ratnavali 4 sthana 216 chapters are there. Okay, so these are the things which is described in the 69th page. Okay, next will be 70th onwards will be, it will be, you can see in the next video.